Hi everyone, in this video we are going to discuss and analyze the news article that we have found which we will apply related course concept into it. The title of this article is Intensive Care Units Working Tirelessly, Learning from Experience, Applying the Treatments in the Battle Against COVID-19, and it was published in ABC News on 20th of July 2020. The article is mainly about the intensive and tiring situation faced by the intensive care unit in Footscray Hospital in Victoria, battling against the second wave of COVID-19 which started in early July. Moreover, it is also about how hard they try to prevent themselves from getting infected by the virus and spreading it to the family members and other people. Furthermore, it mentions studies by researchers on how to improve the shortage of medical equipment and recovery rate. Here is the fishbone diagram which shows the concepts that our group focuses on. They are motivation, teamwork, and decision making and will be discussed in depth through the video later. Now, let's introduce the members of our team. Hi, I'm Wenyu Lee, and I've been talking about the summary of the news article.
Hi, I'm Nurul Nafisa binti Hassan Lafiz, and I will talk about the first course concept, which is motivation.
Hi, I'm Yawen Mai. I will introduce how teamwork is applied in this news article.
Hi, my name is Chia. In this video, I will explore and analyze in detail the concepts of decision making.
The first course concept is motivation. Motivation is the psychological process that arouses and directs goal-directed behavior. Even in the stressful environment with no work-life balance, the health workers are busy working to cure the patients with new cases every day. They are exposed to get infected, so they need to self-isolate when they are at home to prevent their family from potential infection. Maintaining health, safety and well-being is important to increase productivity and commitment in work. However, their ultimate goals, which is to cure the patients, has outweighed their personal needs and motivates them to accomplish it through their effort. This is called as goal-setting theory, which explains how the health workers stay motivated despite the challenges. They can promote engagement, pride and satisfaction through their effort to cure the patients. The public economics literature assumes that most of public service workers' satisfaction comes from helping other people. This is evidently explained by how the workers are extrinsically motivated to gain the payoff from serving the patients and motivates them to achieve their goal and save many more lives. On top of extrinsically motivated, they are intrinsically motivated to make some time to satisfy their personal needs, which is to create friendly and warm relations with other people, given that nurse staffing, patients care and staff-patient interaction are practiced in the hospital. According to McClelland's acquired needs theory, need for ovulation is one of the three needs that is important to create a responsive work environment. By pleasing their own needs, it has motivated themselves to strive in the task despite facing the current difficult situation.
The second course concept is groups and teams. Team is defined as a small group of people with complementary skills who are committed to a common purpose, performing goals and approach for which they hold themselves mutually accountable. Effective and efficient teamwork can be constructed through cooperation and norms. ICU in the hospital tries to apply these works to increase their work efficiency to handle the public health system pressure brought by the pandemic. Cooperation exists in the ICU team as each person playing a specific role and integrate to achieve the common goal. They can meet the patient's different needs as the health workers have specific skills. By combining the health workers' strength, ICU can work efficiently. This is supported by Donovan et al. With the concept of interprofessional care, which refers to healthcare professionals with overlapping expertise and an appreciation for the unique contribution of other team members working as a partner in achieving a common goal. This indicates that cooperation provides health quality care to patients with diverse needs. Additionally, health workers also establish norms to construct an effective team, which is the underwriting rules for the team. With norming, team members are clear about what they should do in order to reduce the negative effect on the team goal. The nurses and the news in the hospital have certain rules to obey, such as wearing face shields, watching what is happening in the room to reduce the chance of getting infected. Teamwork in the ICU helps to reduce the distressing by integrating individuals' efforts and set up rules to improve the efficiency and decline the rate of getting infected, which also achieve their goal of saving more lives.
The hot topic of the discussion is decision making. Decision making is the process of identifying and choosing a course of action. Might be rational, but it is usually non-rational due to complexity of situation and dynamic environment conditions. Decision making can be confronting and challenging when there are often constraints such as time, cognitive capacity, according to the economist Herbert Simon's theory of bounded rationality. It is clearly shown in the news story that due to these constraints, researchers from Vincent's Hospital in Melbourne employ Simon's a rational model of satisfying in response to COVID-19 crisis. This model allows researchers and doctors to seek for alternative treatment that is satisfactory but not optimal. In this case, they did study about the use of heparin, a blood-thinning medication that helps people with lung injury, which is similar symptoms to COVID patients. Heparin is not proven to be a vaccine, but it indeed assists patients to breathe without ventilators. Such a fixing model is effective in this scenario as it outweighs advantages in from delaying decision making until all treatment information are available and wait, hence giving the critically ill patients a fighting chance. Satisfaction and intuition are necessary in situations where rapid responses are essential and benefit them from expansion. CLV et al. 2012 explore satisfying model should be employed by those who possess knowledge and skills. The study provides a positive correlation between knowledge and decision making, providing opportunities to increase hospital decision effectiveness in uncertain situations. Hence, it is important to recognize satisfaction as irrational decision making and embrace some changes in this model so it can best suit individual or situations. Irrational decision making may lead to new discovery of knowledge, but biases could underlie in these decisions. Doctors in Footray Hospital are influenced by contrast effect in confirmation bias, as they recall their past experience of using heparin treatment with lung injured patients, and therefore they evaluate this event similar to COVID situation. Another possible bias in the story is hindsight bias. Doctors might be affected by I knew it all along effect as they predict treatment based on expertise and knowledge. This can be problematic as a complex situation like COVID-19 require constant clinical trials and development of new therapies to achieve desired outcomes in the long run.
What are the lessons that we have learned? We have learned that extrinsic motivation and intrinsic motivation are complementary. It is important to balance out both to achieve one's need for achieving better performance in a task. By fulfilling the desire of both external and internal payoff, one can accomplish the task given with better performance, higher efficiency, quality, and satisfactory. This is indeed a very vital skill to have for our future career, especially when working in a stressful work environment.
The lesson learned from this article is that in the future career, teamwork is significant as the majority of the organizations need to work in the form of team. Identifying my own role in group is that task role or maintenance roles is important as I can provide proper support to other members. If I'm a leader, I should encourage my members and resolve the conflict within the group. Additionally, identify the role can also contribute to the norms because putting myself in the right position and follow the rule of my position may considerably reduce the misunderstanding with my members and employers, which can contribute to the construction of the effective teamwork.
I see the need to embrace both irrational and rational decision making as they complement with each other in various situations. In pursuit of a managerial role in rapidly changing world of engineering, I will approach the satisfying model in the short run as it is proven effective in the news, and then use rational model to reduce biases in the long run when information is available. I can develop this in the future by taking initiative to participate in real-world engineering projects on a small scale initially, and incrementally learn the procedures and steps of training to gain foundation and offset the lack of experience.